Welcome everyone to the Wednesday morning series. Dr. David Fawcett, author of he's got Less Men and Meth too, but my new favorite book is Sex Under the Influence. Um, Understanding and Healing from Sexualized Drug Use. And he is, I always learn so much when Dr. David is on. There's always new things happening in the world, of substances and substance abuse and co-occurring with sex and porn. And so Dr. David brings a wealth of information. We invite you that are joining us live to ask questions in the Q&A, but please, if you are out there and watching this afterwards, you can always email Tammy, Tami, at seekingintegrity.com. Then I'll do my best to get your question answered either through Dr. David or through other resources that we have. So without further ado, what do you have for us today, Dr. David?
Good morning, Tammy, and thank you for that lovely introduction. So just for people on here, I'm a CSAT, so I know some people may want questions directed toward sex addiction, porn addiction, or betrayed partners, and we can easily talk about that as well. That's always fine.
Correct.
My specialty, as you indicated, is what we're calling sexualized drug use. So I just want to say a few words about that just to open, and then we can go over people would like us to go. But this idea of sexualized drug use, it may be a new term for people. It's used as kind of a substitute for the term chemsex, which also may be a new term for people, but it's not a new behavior by any means. And what it is this combination or interaction or co-occurring disorders, one involving drugs, the other involving sex and porn. And this is probably as old as time, but around 20 or 25 years ago, the strength of some of the drugs involved increased and the behavior increased, and we had online accessibility and portable phones and all these factors kind of came together to create what really for the last 10 or 15 years has been a kind of on fire epidemic of people using drugs and sex and kind of getting all tangled up with that, where one can lead to the other. You can see a sexy person want to use a drug or vice versa. And it just kind of hijacks people's arousal template. It hijacks people's ability to have to perform sexually. It certainly hijacks intimacy and kind of is catastrophic for a relationship, just like sex and porn addiction. But it has the added oomph of substances kind of magnifying the extent of all that. It started out, or at least the first things we noticed were among men who have sex with men, largely gay men, bisexual men who would use a lot of amphetamines, poppers, which are a drug, an inhalant commonly used in the gay world, a drug called GHB, which is like Rohypnol, the date rape drug, and those would be combined with sex and porn, and that kind of took off, and we saw people getting more and more outrageous in their behavior, driven really by amphetamines and all the consequences that go with that: psychosis, really bad behavior, really a lot of physical ailments, heart issues and strokes and so on. What's happened, and this we observed this a lot at Seeking Integrity over the last, I'd say 3 or 4 years, is that we're getting a lot of heterosexually identified men who have discovered these same behaviors. And there's been a blurring of these lines between what used to be kind of gay behavior versus straight behavior. I guess we're in that non-binary world in that regard too. And so at Seeking Integrity, we saw a lot of guys coming in who had started getting into amphetamines and sex, but this time doing the same thing the gay guys do, going on the apps, going on Grindr and Scruff, the gay apps, and finding sex and finding drugs and sleeping not only with women but with other men. There's a particular fetish appeal at transgender women. So this broad, it's just spilled over all the boundaries. And now we're seeing a lot of people having this issue. I know, Tammy, you've gotten calls. I've gotten calls from wives asking, like, what is going on? Is my husband gay? Because I knew he was a sex addict, but I'm also finding out he's sleeping with other men and transgender women, and like, what is going on? And so it's very confusing for people. In my experience, while the person might be sort of bisexual, oftentimes, though, it doesn't have to mean that at all. The person could be heterosexual, but we know that the drugs can cause a lot of poor judgment and an expansion of arousal templates, and really kind of anybody will do when people are in that headspace. So it's something that really I'm trying to kind of spread the word about because it's really confusing for people. I testified in a court case in Oregon several months ago about, it was a custody case. They were already divorced, but the former wife, had found that her husband, who was a physician, um, was having all kinds of sex with men and using drugs, and just it didn't make sense because she'd always known him as a straight person, and she wanted to withdraw his ability to have custody full time or even part time. So, and this made sense to nobody in that case until one of the attorneys in the case found my book, Lust, Men, and Meth, and it kind of, oh my God, it all fell into place. You know, this guy didn't start this behavior until he started getting involved with amphetamines and blah, blah, blah. So we're seeing this all over the place. And I think it's important for people to have awareness of it. The bottom line behavior for a lot of um, users is that they really need to work two programs of recovery, one for the sex addiction side, one for the drug side. And you know, of course, there's overlap, but there's a lot of tools in the sex addiction side that people that go through traditional substance use recovery programs, or even treatment for that matter, never get, like the circle plan and a lot of the 3 second rule, a lot of the tools that we have. So that's really critical. But it's also really important for people on the sex addiction side to know that their drugs can affect what happens. And it's not just people with amphetamines acting out. It can be lone people with using cannabis and porn, for example. So there's all kinds of combinations that can impact people. But the bottom line, from a devastating effect on life point of view, is that this really impacts people tremendously, just like any other addiction, but I find even more devastating sometimes. So relationships take a hit. Partners just don't know what's going on. They're hurt, they're disappointed, they're kind of left out of this whole process, and they wonder, who is this person, right? And so all the kind of standard stuff that we see with addictive relationships comes to the fore here as well. So I'm just kind of spreading the word, because a lot of professionals aren't savvy to this. A lot of people think, well, I was trained in either sex and porn addiction or substance addiction, and well, that's not an issue for me. Well, yeah, it might be, right? And the same thing with partners or family members, or even the clients themselves, who are confused, like, what the heck is going on? Because my behavior has changed so radically and they don't really know. So anyway, enough said about that. But I just wanted to kind of spread the word and just try to raise awareness about this. And it's all explained in the book, Sex Under the Influence, but also good information here as well. So, thank you.
Yeah, and a bunch of different things. You know, we have a lot of people that go to substance programs, and they are told, if you just stop the substances, it's all going to be fine. And we know that that isn't the case. You also use sleeping sleeping with, and I was like, no, they're not sleeping with, they're having sex. And one
Yeah,
of the
good
things
point.
when you're talking about those apps, and like, I'm not being trite, but it's one of those things where they're using apps because the hookup is is convenient. You know, like, they're having sex with whomever, and there's no romance, there's no relationship, this is this is just
Oh, it's
acting out.
strictly
So
transactional. Yeah.
thank you. Yeah, and that's why that, because I was like, oh, it sounds so no, they're not having,
Oh
they're not
no.
going out to dinner, they're not doing any of that, type of thing. And even when you're talking about, is my husband gay, and we get lots of that. It's the convenience of, this is a this is an ability to have sex with something, or someone, and so it isn't, like, if and when we don't know, Dr. Rob always says, it's a red herring who they're having sex with. It's interesting, but it's also, there's so many problems at this level. Let's address those, and figure things out. It's not relational, and it's terrifying for partners. And then you were talking about as old as time, and I thought, you know what, in the AA Big Book, Bill W, like, it's well documented about his struggles with alcohol and sex. Like, he was not a faithful husband. It's well documented. I'm not telling secrets. And so I'm like, yeah, this, like, yes, we have stimulants that are adding a lot to the mix, and making brains explode, but yes, substances that minimize inhibitions, impair thinking abilities, like, yes, anything that has been doing this, and like you said, forever, it has has the ability to cause, problems in the co-occurring. So going back to what we talked about, and we do have a question, but what we talked about briefly was, when people, think, well, I will go off to the side. Yeah, okay, the substance is an issue. I'm going to go get, help with that. And one of the challenges with substance programs, or just substance sobriety, is it's abstinence, and then you're sober, and you're not addressing holistically all the other issues, or co-occurring. It, like, literally the definition is, if I'm sober from substances, great, I'm getting chips, I'm doing great, and we're not looking at the other things that people can be using. We look at gaming, food, obviously sex and porn addiction, but we're looking, smoking, vaping, like people go, oh, it's just smoking or vaping. No, like, that keeps that dopamine going and will keep people from having to address. It's still, they're using it as an escape, and so they're not addressing the issues, which is what recovery is about, is learning to deal with uncomfortable feelings and dealing with life on life's terms and all of those things without, escaping to, to non-porn porn, TikTok, Instagram, Facebook, all of those things, like. And some people are going, oh, I thought those were okay. No, like, we have got to live an examined life in recovery, because anything we're using will keep us from true recovery. Now, does it sound daunting? Sure. And is it something that you're going to magically get in, a short period of time? No. But, getting the right help makes all the difference. And, that is why we, at Seeking Integrity are going, we've had people that literally have, gone to a substance program and transferred door to door to our program, because there was a realization that that wasn't going to be enough. Okay. If they didn't start with us, we sure want to be the place where they get the help that they need in, order to be, on a different path. And this is a lifelong journey. The precursor to this stuff happens before age 10. So we find, some way of numbing out, escaping, and it accelerates, and like you're talking about now, like, okay, I might have been drinking or using pot or whatever, and then I found porn, and then, the escalation, the higher intensity, needing more, to escape and numb out, not
Pat,
always with good consequences. Yeah.
you noted that how easy it is to just transfer addictions. I'm in recovery in Alcoholics Anonymous, and I look around the room of people, sober people in a 12-step recovery meeting, many of whom, sort of just by what they say, are really sex addicts or porn addicts, and they've just transferred addictions. And I use that term whack-a-mole. If unless we get to that, you're talking about, I love it, this layer of stuff underneath, right? All that stuff that's driving the addictions, whatever they are a symptom. And it's a coping mechanism, not a very good one, but it's one that we use to check out and numb and delay and avoid and just not deal with. And unless we deal with the stuff underneath in a healthy way, we're going to keep having that urge to kind of numb out. And it's so easy just to skip from one thing to the next, from alcohol to other drugs, or if we put that over to food or uh, gaming, or it's just, or porn. It's just so easy. I see this all the time with clients bouncing back and forth and not understanding what they're doing. They're just desperately trying to find new ways to self-medicate. So unless we go to that underneath, right, what's driving that, that's really critical. And that takes and you rightly point out, that's not a quick fix, right? That takes a lot of time. But the beginning is getting sober from all this stuff. Then you can really start to work on it.
Well, and we talk a lot in our, treatment program and everything else about, if there's an uncomfortable feeling, processing through that, rather than, rather than going to something external to make it feel better. I too sit in 12-step meetings, and, newcomers come in, and this is with zero judgment, but, they'll gain 40 pounds in the first couple of months. Honestly, I did as well when I first got, into recovery, which, because I was eating massive amounts of sugar, to help numb out. So having to learn how to, address those things, so that I was like, okay, that, this sugar isn't going to make me, well, it makes me feel better in the moment, but, it ultimately doesn't make me feel better, and how do I learn to, cope with those things? So, it is a process. And the more we're unable, or the more we're able to unpack, those things, and look across. It's why, in 12 step, which we both, are members of, we talk about doing, doing the steps, working the steps helps us identify some of those, those things. Now, I often say, and I think you'll concur, Dr. David, that when people have these co-occurring issues, it is challenging to address all of them on the outside world. Not impossible. It just takes a lot more intention. So having the ability to get a higher level of help and get that solid foundation and have a plan, for those that can, it really makes a huge difference in the ability to, get some traction early on.
I agree. And I think if you look at the literature, from treatment literature, it talks about getting people sober first, right? And normally that's true if you're dealing with co-occurring issues like, say, anxiety or depression or whatever. You can't treat anxiety or depression if somebody's high. And so to really get that makes sense then. However, when we're talking about this fused sexual behavior and drug use, it's all the same thing, and you have to treat both at the same time, right? You have to stop the drug piece, and you have to stop the sexual acting out. Those two are so tangled up. You can't sequence them and do one first, then the other. It just won't work. People will relapse. So that's a really critical difference. And there's not many places that do that, right? And so that's where we're different at Seeking Integrity. But that's really vital, in my opinion, to treat them both at the same time.
Okay, so the first question: I appreciate your passion to helping those who really need help. My question is, why do sex addicts start with normal-ish vanilla sex, and in a few weeks one offers Molly or LSD and weed? I am guilty. Since the first person promises wild sex on drugs, I'm not sure what drove me to it. That's a great question. And it's such an addict, I mean, like, yes, of course we do. Oh, that'll be even better. More intensity.
I think in one of the ways I describe sex addicts and sexualized drug users is intensity addicts, right? It is all about the intensity. And really, what do those things do for us? They release a ton of adrenaline and dopamine. It's literally, it's very similar to our body's reaction when they go into fight or flight. And it's just like that rush of intensity. And even physiologically, we get tunnel vision, our digestion stops. We get a lot of blood flow to our limb, just like fight or flight, and our heart races. The problem, fight or flight is meant to be engaged in like 2 or 3 minutes to get us out of danger or fight our way out of danger. But when you're doing this stuff, the chemsex addicts will do it for 4 and 5 days, right? So their heart is racing and revving, and that's why they're getting strokes and heart attacks and having pulmonary hypertension and things like that. So yeah, we're all intensity addicts. It makes sense that we would escalate, and why not? And I think a lot of us, from that addictive point of view, really kind of want to go for more. And the other thing that's working to kind of fuel this process, I think, is tolerance, right? And tolerance and escalation. That very quickly with these intensity addictions, whether it's sex and porn or amphetamines or other things, um, we get used to it. And so what we did this week, next week or next month may not be so interesting. It doesn't give us the same bang or intensity that we had. So we up the ante a little bit. And we see this with sex and porn addiction too, where people start, okay, well, they start out with a certain kind of porn, for example, and then suddenly they're interested in maybe things that are more taboo or fetishy or rougher or whatever. We see the same thing with behavior. And it's all about that chase for intensity. And the problem, and this has long been in the addiction literature, is that we never can really recapture the intensity of that very first experience. Tammy, I don't know what your experience, but I certainly spent a lot of years in my addiction trying to kind of get back to where I was and looking for the magic formula to get me there. And I think every addict goes through that, and it's a chase that we can never win. But the problem is with these, what I call intensity addiction, sex, porn, and chemsex, it can really lead us down into very dark rabbit holes and be very devastating for our sexual functioning on an ongoing basis, even in sobriety, and certainly in relationships. So it's just really serious stuff. But I think there's this natural inclination to seek more, right? And how what other kinds of experiences can I get? And by the way, interestingly, there's also been research on the personalities that get involved with sex and porn addiction and chemsex tend to be what are called sensation-seeking personalities. So these are people like their whole lives have been the people that, drive really fast on their motorcycle with no helmet, or drive cars really fast, or ski down the backside of the mountain, or do bungee jumping or parachuting, or all the kind of stuff that gets that fight or flight, am I going to die thing going. And that's kind of what they're trying to replicate with their addictive behaviors. So very fascinating.
Okay, I was going to check. I bungee jumped. I haven't parachuted yet, but it's on my list. But anyway, yeah, I have a turbo car. Yeah. No, I do like, I love roller coasters. Yes, I get that there's that. And that life in recovery is on the more boring side. I was also thinking when I was reading this too, that we often make poor choices. Like if you're already under the influence of one thing, then somebody offers you something else. This happened to me all the time, and I was like, sure. I took whatever was handed to me. Like I, I'm lucky to be alive. I get it. But we make poor choices because we're already, part way impaired, and what Dr. David was talking about, I always think if a little is good, more is better, I mean, my
That's
brain
right.
still thinks that way. I have learned
Right.
to moderate, but if one cookie is good, six will be better. No, it won't be. And but like there's a whole conversation I have to have with my head, going like one cookie is fine, so there's just something innately about us that we have to learn to like to use our thinking part of our brain instead of our compulsive, that is always going to go, yeah, that would be great, without the thinking through the consequences.
No, I just want to throw in one thing too, because I kind of made it sound like, well, all this intensity goes to the addiction, but recovery is like boring, but it's not, right? That's not the way it is. And I think we recovery, because we're present in our lives, we're actually feeling stuff, can be incredibly intense, but it can also be all kinds of other stuff. It can be happy, and sometimes it'll be sad, but we're going to be there and we're going to be present. And it's as intense as we want it to be. Uh, in recovery, we can still bungee jump or parachute, or whatever we need to do to get intensity. So I don't want to make that confusion that, oh my God, I'm going to live the life of like boring. What's the point? That's not how I'd encourage you to talk to recovering people and see that's just not the case.
Well, and the other thing is, like, along with all that intensity came a lot of chaos. I was
Oh my
always
God,
in
yeah.
cleanup
Drama,
mode,
chaos.
Yeah, it was insane, and I don't have a tolerance for that anymore. I want to have my relationships in a good place, and I do what I need to do. If something's off kilter, I work on, making sure I'm taking care of my side of the relationship, so that I'm showing up with integrity. And yes, like I have lots of intense things. They just aren't without the really severe negative consequences of the drama of being impaired. And so I often say, Dr. David, if I could wave a magic wand and people could see how good life is really in recovery, everybody would be like, yep, that's what I want. But in our addiction, we are so focused on hanging on to this most meaningless stuff. Like there's no substance in any of this stuff. And we're like going, oh, I got to hang on to this. What am I going to do if I don't have this? And I remember when I went off to treatment, being terrified of, like, I don't know how I'm going to live without these. I didn't call them maladaptive coping mechanisms at the time. I just did not know how I would ever, live without. I was a daily, addict at a very young age. Like I didn't have a whole lot of time left to be out there. So gratefully, people showed me a different path, and they told me, they said, you can have this too. And I believed them, and they were right. I didn't go, oh no, I'm too far gone, so
Right.
recovery is so worth it. If you're struggling, man, we have so many resources, including Dr. David hosts the Tuesday night co-occurring sex and substance drop-in group free. But we have the Sex Addiction 101 starting again on 11/2, so November 2nd. Both of those could be good. And we have, we have an expert residential treatment program that, can really help get a solid foundation. Okay, the next question, Dr. David. My husband is a sex addict. We are nearly 1 year post-discovery. He lived a double life. His acting out partner and him lived a distant relationship, saying, I love you to each other, spoke of children, marriage, her moving here, etc. Are most relationships purely transactional? I'm trying to understand the relationship portion of his addiction. He says now with sober brain, it was part of his addiction. It was the excitement and power and control and manipulation, etc. It is confusing.
Yeah, I mean, it's confusing and complicated, right? I think when people are in that fantasy space, and I think when we have an affair or any kind of external relationship like that, we're often operating in that bubble. We talk about sex addiction, right? We're not thinking clearly. And just to think about love and romance addiction with oxytocin and all these kind of hormones and chemicals that make us feel good and make us high. And I think sometimes when we are engaging with an affair partner, it involves that kind of fantasy space that is a rush because it's not real, right? There's no real responsibilities. There's no real kids. But the fantasy of that is something about making house, playing house. Just I found it's not real for the most part. So yeah, I think it's kind of it's you can almost call it delusional. It's this fantasy space that people go on. Do they understand that? No. I think one of the things with addiction is that we get what I just call tunnel vision, where our vision gets so narrow, we don't see the bigger picture. And unfortunately for partners, we also don't see the real impact of what we're doing on people we love. And so I think that this is a well-known fact, right? With these intensity addictions, empathy is what takes a hit, right? Our compassion and empathy, our ability to understand how our behavior is affecting others, our ability to understand what someone else is feeling. And a lot of it has to do because our own feelings start to just deaden. We're not feeling anything. And the definition of empathy is I can feel what you're feeling. But if I've lost my capacity to interact emotionally anyway, it's kind of takes a hit. So that's a very long way of answering your question. But I think, yeah, this is fantasy space. It is part of the addiction. It doesn't mean, though, that the consequences are any less impactful and hurtful and harmful. And so I think um, it's something to, it's true. I think a sober brain would not do this, but this is not a sober brain making these decisions, right? This is operating under the influence of a lot of chemicals and hormones in our brain that give the rush, give the intensity. Even, by the way, just having something um, secret or taboo is a little bit of a rush. That adds that like a multiplier for the intensity factor. And so all this stuff kind of goes together to make it healing in that sort of secret way until it's not, right? Until it all falls apart and it sounds like if he's in recovery for a year that the the shades fell off and he was able to start to understand his own behavior with a sober brain this time and with the impact. So hopefully that's getting there. But I think a lot of these decisions, a lot of the fantasy, a lot of the play acting, and some of it's real world too. I mean, people can have affairs and meet and all that, but it's based on this fact that it's kind of this impossibly unreal, let's say anyway, totally removed. And to bring it back to what we were just talking about as addiction as a coping mechanism, I think sometimes, very often, if not most of the time, when people are doing this, it's because they really need to bring their issues back to the relationship, right? What is going on? Let's talk about it in the home. And some of the models of couples therapy, they talk about an affair. Well, I'll back up. If we talk about a healthy relationship as a house, all that energy should be contained within the relationship, right? An affair is basically a back door. It's letting the relationship energy out. And so that needs to be brought back in. And that's why we talk about communication and then lots of good skills for couples and healing. But it's a very difficult process, and it's a difficult one for both parties, but I think especially for the injured partner, just who really is reality based the whole time, right? And witnessing this thing and seeing what's going on, and confused by it, like what is going on here, because it doesn't make sense. And this addiction is never rational. It doesn't work from the rational mind. It's out, I've already operating out of the midbrain, the emotional brain, right? It's just so it doesn't make sense in that regard.
Well, and I say this to partners all the time. Of course, it's confusing. Your brain would never think this way, and we're addicts, so we get it, and it's not justifying any of this. It is just saying, yeah, we make horrible choices. But your question was, is it purely transactional? No, I mean, there are people that it is all transactional. And we actually discern, there are different kinds of addicts. I mean, even an addict who, again, just making, silly examples, but, goes off to Vegas and, has sex with a sex worker versus, has an affair partner locally, or at work. Those are very different, situations, and there's different underlying things, underneath that. But yeah, the whole fantasy, like again, as Dr. David was saying, think about the reality of this. This person is distant. We can say all of these things. There's no paying the bills, taking out the trash, doing life stuff. Who's going to make dinner tonight? All this. It's like all, this delusional fantasy stuff. And that's, I mean, so flipping it a little bit, like this is why, gaming is, challenging. And we look at people that, well, it's just gaming. No, it's not just gaming. It's this whole, fantasy world and all of that kind of stuff. And if we're constantly escaping our reality, that would need to be looked at as well. I'm not saying games are bad. I'm just saying we have to live an examined life. But from a partner standpoint, of course, this makes no sense. And how compartmentalized it can be. It's like, I can be, on the phone with this person, doing, oh, I love you, and da, 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 and then come in and go, okay, what's for dinner tonight? That's how compartmentalized it is, and that's the challenge of like bringing the brains together, and making sure that those compartments are not, in silos. That this is now, okay, we have got to, think about all of these things. So it takes work, but we can do it. But the partners, I think at best you can go, okay, there was brokenness before age 10. These are maladaptive coping mechanisms. They make no sense to me, but this is the person I have. And if this person is working on recovery, I'm seeing a change in them so that they're taking responsibility. They're learning to have skills, for empathy and showing up. That is that's the win. But you will never completely understand. Yeah, I mean, my husband and daughter, they have neither one known me in active addiction, and it was a while back, but they looked at me one time, whatever I was saying, and they said, "You think differently," and I was like, yes, I do, and I have recovery to help me, be aligned with, proper thinking within the world. And I still will phone a friend if I'm thinking about something and I go, that's probably not a great idea. I will reach out and have them remind me why it's not a great idea. Because if I'm thinking this is not probably, I should check in with somebody, I probably need to. So I'm just telling you what you're up against, but I'm also telling you we can learn, with the right work and tools, we learn to be different people. So there's truly hope. Don't please know that this, it doesn't sound hopeful, but I'm trying to give you hope with this. So okay,
I just say one more thing, just
yeah.
to underscore your point about transactional versus not. With chemsex or sexualized drug use, it's very often simply transactional to the point where people don't want to know names. It's totally anonymous. In fact, I've had clients talk about finding some real bit of human information about the person they were having sex with, and like it blew the whole fantasy, right? Because
Oh,
those transactional moments are all about imposing. If I'm the person acting out, it's my fantasy on this body. I don't care who you are. In fact, that ruins the whole thing, right? And so you do see a lot of that. But what you're talking about in that example is something more, where there's actually some interchange, some communication back and forth. It's still a fantasy, but it's just a different style. It's more relational, if you will, sort of pseudo relational, call it, than that transactional thing of like, I don't know your name. Let's just do the deed and get out of here, kind of thing. So. Yeah, there is a
Y-
distinction.
y- Yeah, yeah, and very different profiles of the people who are engaging that way. Okay, Dr. David, does daily weed usage and taking prescribed Adderall for ADHD put you in the category of chemsex addict?
Well, chemsex addict would have to add to that some sexual behavior, right? And that can be pornography, it can be sexual acting out. So it certainly puts you in the potential for addictive behavior, but to be chemsex, it would have to be, and this is, by the way, very common to use weed and ADHD because the Adderall is an amphetamine that has the same effect as to a lesser degree, but still a powerful one as meth or cocaine. It increases that sexual arousal factor. And so, and daily weed kind of mellows it, but both are easily attached to sexual behavior or sexual fantasy. And so I think this is the big red warning flag. I don't know if this would describe an addict or not. I will say daily weed usage just by itself is problematic. Um, I mean, big time problematic. Tam and I were talking about this recently, where because marijuana is legal in so many states, there's a medical marijuana. There's this whole, and there's been studies of this too, where the perception of its so-called dangerousness has gone way, way down. Where people just, that's another drug. It's herbal. It's natural. And all that's true. However, it's been refined. These strains are so refined; they're extremely strong. And I'm sure you probably smoked some pot back in the day. Tammy, so did I. It would. It was like
Baby pot is what I call
there
it
you
now.
go. I think people are getting like psychotic from the pot out there now. So it's like a totally different animal. So I think that's really something to look at. It is addictive from at least a psychological point of view. And it can, especially on adolescent brains, can have a real impact. And ADHD, all the ADHD medications can be really problematic. There are a couple that are not stimulants, which I recommend for any chemsex or sex or porn addict because they don't increase that sexual arousal, that triggering factor. But yeah, it's a powerful, two powerful drugs. And again, both of them, one, pot is just assumed, well, it's everywhere, everybody uses it. What's the big deal? And ADHD drugs are so, in my opinion, overprescribed that both are very problematic. So big red warning flags there. So be careful.
Well, and I want you to, we were talking literally about cannabis yesterday. So, you were talking about, psychosis, but you also like there can be psychotic breaks that don't repair. Like, can you talk like, I'm not doing a good job with my question, but you know where I'm going.
Yeah, yeah. So
Permanent.
um, right. There is also research that looks at some of the events that can follow misuse of drugs leading to other kinds of mental illnesses. And the two that are under scrutiny right now are methamphetamine, which causes really terrible psychosis, a lot of paranoia. And the meth these days is so strong, almost everybody gets it. Back in the old days, that didn't happen. But now they not only do they get it, but it is extremely strong and it sometimes can be permanent. That's psychosis. So with meth, it's often paranoia. People are following me. There's cameras and microphones in the air conditioning vents, and just kind of. Or I've had a good friend who is in long-term recovery from methamphetamine, saying when the air conditioning's on, he hears voices of people are. He can make out voices talking to him. He's years into recovery. So this is happening. Unfortunately, the same thing is starting to be a trend for cannabis. Cannabis is now shown to actually create some psychotic breaks for people, especially young people, and can lead to schizophrenia and other kinds of mental health disorders, in some cases permanent. And so we really have to be careful about these drugs because not only is it the danger of the drugs themselves, but for certain people, especially vulnerable people, and we don't know, by the way, who, right? I think these are probably people that had some kind of vulnerability anyway, but it can cause really serious consequences. So again, another reason to kind of check your use and be careful.
And I'm going to throw out like at Seeking Integrity, our really wonderful clinicians do not diagnose ADHD or whatever. For those that come to our program, if they need an evaluation, we have someone who is at a higher level that collaborates with us that understands addiction and ADHD, OCD, et cetera. And then they can help put them on the proper medication. So like Dr. David is talking, and you stand best chance of having the symptoms of ADHD or whatever addressed without, it adding to things. To me, like, you know, if you're a recreational user, then you can not use. And so, with a weed, I would invite you, to go without, there's Cannabis Anonymous now. So, I mean, there's lots of programs that can help you, with those things. But if you're numbing out on those things, you're missing life. It was just like I was talking about a little bit ago. If I could wave my magic wand and you could see how good life could be in reality, you'd want it. And I would invite you. Recovery is invitational. We're inviting you, to a different way of being. Okay. The answer rings true. I did all of Dr. F was describing, but it was more to get sex, the manipulation and power. It fed her lines to make her do what I want. It was more grooming and just using love to get sex, as John Gray says. Okay, so I think that refers back to the affair, the long distance affair.
Right. Right.
Okay, the next question. I'm the betrayed. I'm not an addict, and I never use drugs beyond marijuana here and there. But I'm curious. Years ago, I got out of an abusive relationship, and I had a difficult time having sex with men after that, unless I was drinking alcohol. I had sex with that ex after the breakup only if I was drinking. I made risky choices like unprotected sex and one-night stands. While I got out of that habit, I'm still tempted sometimes to use marijuana or alcohol to get through sex and get out of my head and into my body, even though generally speaking, I'm sexually open and sex positive when sober. I've also been raped 2 times since the end of that relationship. Is that chemsex I was doing? Is there anything I can do to get healthier? Thank you so much for asking this and sharing. That's vulnerable things.
Yeah, boy, thank you. I'm so sorry that happened to you and you had that experience. What you described is a pretty common, desire to use substances to make us more comfortable with sex or even with other kinds of intimacy. And so I think it's very common in this country, alcohol, right? Alcohol, and I think increasingly cannabis are very common. And not that that's necessarily the right way, but I think it's an impulse. What I think, putting on my therapist hat, that says to me is that there's obviously some discomfort, and I can see why, with sex and intimacy, with vulnerability, with kind of allowing yourself to relax and enjoy the experience without the benefit of something to kind of help you get there. And so and this brings me to what is the definition of chemsex? Because some people have asked, well, if I have a glass of wine before, my wife and I are intimate, is that chemsex? And no, it's not. My definition of chemsex is when the drug use and the sex get all tangled up, right? So it's usually multiple drugs or a lot of it, but the two become dependent on each other. I can't have sex without drugs, or there's this dependency, that word we hear often in addiction. So I think it's much more complicated than just having some alcohol to relax. However, and I wouldn't necessarily call that chemsex, but I would say that that's probably what we've been using the term maladaptive coping mechanism today. That's definitely one of those, because you're using a substance to help you be more comfortable. And I think with it, so what I would suggest is looking at, and that may be a therapeutic process or talking with your friends or whoever your support system is, like, what can I do to make this experience be more comfortable without having to use the substances to get there? And I think, and this goes to, it is a simple question, complicated answers, right? It goes to vulnerability and our beliefs about ourselves and our beliefs about our body and intimacy and the experiences as children and the experiences as adults, being sexually assaulted and having bad relationships, all of that contributes. So of course you'd have concern about being vulnerable. Saying that's where the healing work is. Should you choose to go there? I think, in my opinion, but I think, is it chemsex? No. However, I definitely see how you're using the alcohol. I would also challenge one thing, because you said using alcohol or marijuana, I forget, to drop into your body to enjoy the experience. I think what's really happening when we use substances, we're checking out. These are dissociative processes, meaning we're disconnecting. And we're disconnecting not only from our moods and our feelings and our fears and all that, but in many cases, we are disconnecting from our bodies. We're disinhibited, we do stuff with our bodies, but in many ways, we're not really experiencing it. One of the joys of sober sex, if you will, is the ability to really be in our bodies and experience it, experience the intimacy without having to check out. And so I think just maybe that's something to think about, because oftentimes we think it's allowing us to be in our bodies. Yeah, it's allowing us to do stuff with our bodies that we might not ordinarily do. But I think in many ways, we're not in our bodies. We're kind of disconnected from it in many ways.
And that's a great point, the distinction between the two. And I was thinking, I mean, your body was used against your body and your mind's wishes, like you were raped, you've been betrayed, all of those things. And so I was going to the place of somatic experience is a trauma, it's a body trauma method. And I wonder if, doing some somatic experience to kind of process through, EMDR, I find really helpful too, but because it's such body things, I'm kind of wondering, if more of a somatic experience could be helpful. But I hear you, I'm in my head, I'm in my head, I'm in my head, and I'm sure your head is going, no, 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 no,
Exactly.
and so, yeah, and so the substances go, yeah, whatever, and so I'm glad you're asking. I'm with Dr. David. I don't see this as, addiction. I do see it as a coping mechanism, but I'm thinking that getting some help, around those specific areas of trauma and the body, could be useful for you. So if you need names of people, email Tammy, Tami, at seekingintegrity.com. Let me know where you're located too, because I will see if I can find somebody who's trained and licensed in your area. Okay.
Beautiful.
My partner, who is a sex and porn addict, his mother was schizophrenic and bipolar. Are there any drugs that could cause a psychotic break for him, even if he doesn't show signs of schizophrenia? Are there any drugs that might be recommended for him for recovery, depression, or mental illness that he could stay away from, or that could worsen his addiction? His current therapist is keeping an eye on him for potential bipolar.
Wow, great question.
Yeah.
Yeah, so those illnesses do have a family run, right? So that there's a predisposition there. As I said, the amphetamines and cannabis are shown to potentiate a breakthrough of those illnesses. So they could cause or increase the likelihood, not cause, but increase the likelihood that he would have a breakthrough of those. I'm glad he's being monitored for it. Um, so I think definitely stay away from those drugs for sure. I think in terms of things to stay away from a treatment point of view, I can't think of anything like that except perhaps stimulants. Um, but I don't see why those would be. I mean, sometimes for severe depression they prescribe stimulants, but that's probably not likely. So I think it sounds like he's under watchful eyes of the healthcare team, and that's a good thing. But yeah, there's a risk for it anyway, and so certainly avoiding the kind of recreational drugs we've been talking about would be important. I can't think of prescribed drugs that he would probably likely come across that would potentiate that breakthrough of schizophrenia or bipolar, but certainly something to keep an eye on. Then I will say, depending on the age, the onset for both those is typically um, 20s, and well, he's a male, obviously, but far more likely male than female of that breakthrough. So, I mean, as you get older, the risk decreases, although the drugs can push that back further. But I think depending on his age, the likelihood may not be that he's probably less likely to show those symptoms, but it's not impossible for sure.
And my caution was, you said his current therapist, and like I just mentioned, at Seeking Integrity, we have, world class expert therapists, and they are not, psychiatrists or psychologists who are able to identify these issues and prescribe, appropriate and addiction minded medications. So, and I've had lots of people who have reached out and said, my therapist says I have ADHD or bipolar or whatever. And I'm like, okay, and go get a proper diagnosis by someone who's actually qualified, because you can read anything on Google and anybody can say anything, and you want the correct diagnosis. You also said he is a sex addict and porn addict, but you didn't say if he's in recovery. And so I'm going to kind of go to that too, of what's he doing for his recovery, path. And, cognitive behavioral therapy works, both with, schizophrenia and bipolar. So if he's on a solid recovery path, then the more we're on a solid recovery path, the less the stuff that would drive us towards the addictive behaviors is going to get be so overwhelming. So the more he's working a good recovery program, I could see him having some stability with that. So this is, I've heard that SSRIs, Wellbutrin, et cetera, can increase relapse in alcohol and sex addiction, respectively.
If anything, in my experience, it's the reverse. For a couple of reasons. SSRIs, which is a very typical form of antidepressants, most of the ones that we use are classified as well SSRIs. They actually can reduce sexual compulsivity, sexual desire in many cases. One of the side effects that's unwanted of things like Prozac is that it reduces sexual desire. So I think, at least in my experience, that's not the norm. There may be a few cases here and there where that might have the opposite effect, but I think in case of SSRIs, not so much. Wellbutrin is another antidepressant, although different family than SSRIs. It's generally considered a stimulant form, although it's not an amphetamine. And so that can increase this a little bit in certain individuals that are kind of hyper anyway. However, interestingly, Wellbutrin is being found now to, when combined with a drug called naltrexone, is very effective at reducing amphetamine craving. So I think the benefit of Wellbutrin outweighs the potential small risk of that. I do want to say naltrexone is a really important drug. Naltrexone is a drug that has been used for years to stop alcohol cravings, or to reduce them at least. So very helpful for that. And then it was discovered it's also so helpful for opioid cravings. And so it's a really not a magic bullet, but it's another tool in our arsenal, if you will, to just help people not suffer the experience of those intense cravings. We didn't have anything like that for methamphetamine for years, and it was a problem. And then the last couple of years, there was a study in the New England Journal of Medicine a couple of years ago that showed combining naltrexone with Wellbutrin really effectively reduced methamphetamine craving. So with all that said, I think bottom line, I think most of these drugs, it's almost the opposite. I think SSRIs and Wellbutrin can actually help reduce cravings and decrease the risk of relapse, for sure. Now, the same thing goes with sex addiction. SSRIs are often prescribed to reduce cravings for compulsive behavior, but also in some cases for sex addiction cravings. So in my experience, at least, these actually do the opposite. They're a tool that we can use to really help fight off those cravings for addiction, whether it's sex addiction or chemical addiction.
So when it's being prescribed for sex addiction, et cetera, like is somebody getting it? Here's where I'm going. I know lots of people that go to their nice general practitioner and get put on anti-anxiety drugs and all this, and that person does not know the complexities and isn't really monitoring things. So I'm always go to a qualified professional who can monitor all aspects of this. So that's, yeah.
Right. And most psychotherapists, well, all psychotherapists can't prescribe, right? Prescribing as a psychiatrist in this area, and ideally an addiction psychiatrist who understands addictive behaviors, addictive processes, and psychiatric medications. And they can really put it together very effectively. Because the other thing too, you don't want to over medicate, and I don't believe the solution here is always a pill or a medication to help. But in some cases, you know, we can judiciously kind of see, okay, is this an opportunity where it might work without causing harm? You know, how many of us have encountered people over the years who have been overprescribed or prescribed the wrong thing, or they come in on drugs that are actually, you know, fighting each other. It's crazy. And so we need to be careful about adding drugs to the mix. But I think there are some well-known drugs in the right hands of a skilled clinician, a psychiatrist can really be helpful to reduce those cravings for people and to keep them.
And it can be for a short time. I mean, it can be like while you get, but like when somebody has now substituted and I'm on these, forever, like maybe, but, I think it's always one of those things to be looking at is what is effective, what is needed, and for how long. So it could be, to get over that initial craving, get, some stability, and then, get weaned off of those things. But I'm big on making sure that you have a qualified professional. ASAM, the American Society of Addiction Medicine, has addiction trained doctors. This is a separate field because many aren't, and so they'll just hand you pills. And so you really do want qualified professionals, and the good ones in your area may be known to your therapist already. So, they may have a relationship and go, I work well with this psychiatrist who is able to address these things. So we'll lean into the professional help. Like I say with lots of this stuff, this is not a do-it-yourself, like I was thinking with the, pot and ADHD, the Adderall, I'm like, self-medicating, and we see that so
Exactly.
often. I mean, I did the same thing. It's like, and the ups and downs, and we've talked about, like, oh, I forgot which one it was, and you'll remind me, but it was like, okay, this is two up, so it has the opposite, they were combining drugs, which I was like, why would they do that? And you're like, because this is too high, so then they're using this one to level it off. And I'm like, well, you know,
Like GHB, trying to find just that
yes,
Goldilocks spot,
yes,
right?
that's what it
Just
was.
right.
Yeah, yeah.
Yep.
I got to find the magic. This is just perfect until it isn't, because now I need more of something, so everything escalates. So, okay. So we are basically out of time. Thank you, everyone, for the great questions. And Dr. David, as always, it's great. If you have not already picked up a copy of Sex Under the Influence, highly recommend it. He has podcasts on our website and more of these webinars. So there's more information. We're here to help. You can always reach out. So, and I'll see you
Great.
again in 2 months.
Great. Thanks, Tammy. Thanks,
Thank
everybody.
you. Bye bye.